The number of people going to the emergency room for opioid overdoses across the state is going down. In September, nearly 800 people are reported to have gone to ERs in North Carolina for overdoses. Last month, that number was lower, 700. Several parts of the state are receiving money to make that number go down even more. WRL's investigative data journalist Ali Ingersoll joins us live with how the money could help save young people's lives. Ali?
Gerald, yeah, last month, about 20% of the people who went to the emergency department, they were young people under 25 years old. And that's why today some of the ideas floated included opening treatment facilities for people under 18, enhancing messaging around mental health, and altering what a response to a crisis for young people looks like. There were doctors, social workers, people in recovery, all joining together today, brainstorming how Wake County could use some of its more than $30 million to help some of the youngest people who are dealing with substance use disorder.
They have ambitions, they have dreams. No addict wants to become an addict.
13 months ago, though, Jack Brigham says he didn't really have any dreams. He couldn't imagine graduating high school and definitely didn't expect he'd be here in a room with Wake County officials discussing how to talk to and treat young people living with substance use disorder. The Cary teen says he didn't expect to even be alive. When he was just 8 years old, he says he first tried alcohol and then marijuana. And then it progressed.
From there, it was more like, what more can I do to feel normal? And the only time I was ever really happy was on drugs.
By the time he entered a rehab facility just before his 17th birthday, he says he tried anything and everything.
I was so scared that when he was upstairs sleeping, that I would be afraid to go up into his bedroom because I would be afraid that he had died.
And that's a legitimate concern for parents like Jack's mom, Rebecca. Between 2016 and 2020, state data shows that more than 1,900 young North Carolinians, 24 and younger, died from overdoses.
Even though I'm a social worker and I'm in this field, I really thought we're the only family dealing with this in the whole county.
So today, during the meeting, she urged leaders to use opioid settlement funding not only to bring new programs to the county, but also to strengthen the services already in place. Nationwide, the settlements have amounted to more than $26 billion, with North Carolina receiving $750 million. And Wake County, $36.1 million. The Attorney General says making sure all voices are heard in every county so that funding is allocated equitably is critical to addressing the crisis.
We have incredible hard challenges ahead of us, but when we work together, we can solve problems.
Problems and challenges the Brighams have had to overcome.
I love you.
I love you too.
Stein says it's possible that details about more settlements could come down as soon as this week. And Gerald, that means possibly millions more in funding for Wake County and North Carolina.
This is such a big problem. We can't talk about this opioid issue too much. Ali Ingersoll, live in Raleigh. Thank you, Ali.